Go ahead, Bob.
Okay. Well, welcome back to Dispatch Radio. As some of you may be aware, there is a new virus being reported out of the Arabian Peninsula, primarily out of Saudi Arabia, that has affected some 79 people as of yesterday. It's called the Middle East Respiratory Syndrome Coronavirus, or MERS for short, and it's drawn a lot of attention from health officials all over the world. Here to discuss MERS a little further, on the phone, we have a friend to the globaldispatch.com, Dr. Vincent Racaniello. Dr. Racaniello is a professor of microbiology and immunology at Columbia University. Hello, Vincent, and welcome to Dispatch Radio.
Morning. Thanks for having me.
Great. Well, you're a virologist, so let's start out with a little bit of virology. There's been a lot of comparisons between the MERS coronavirus and the closely related SARS coronavirus that sickened over 8,000 people and killed nearly 800 a decade ago. However, they're not the same virus. What is the difference between them as far as the ability to cause disease, lethality, the ability to kill, and human-to-human transmission?
Well, as you know, about 10 years ago, the SARS coronavirus emerged in China, and that ended up infecting about 8,000 people worldwide, and it killed about 800. And then, for reasons we still don't understand, it disappeared. So that virus was not bad at spreading among people. 10% lethality, which is high, but again, it's gone. Now, about a year ago, a new coronavirus emerged in the Middle East, and it's the MERS coronavirus. It so far is not particularly good at spreading from person to person. It's, as you said, it's just infected about 80 or so people, and about half of them have died. Now, we really don't have the numbers to calculate the actual mortality rate of that virus yet, because there have been so few cases, and most of the people who have been infected have other health care problems, and so they're probably particularly susceptible to infection. So I would say that this new virus, so far from what we can tell, isn't really good at spreading from person to person. And as far as its lethality, it could be as lethal as the SARS corona. It could be slightly more lethal. I think we don't have the data to really answer that question yet.
Okay, the numbers of 79, do you suspect that number may be higher due to undetected cases?
Absolutely. I think that the 79 cases are the ones where the people have gotten very sick, they've gone into hospital, and they've been diagnosed with this virus infection. With most viruses, many people get infected and have either mild symptoms, so they never go to a healthcare provider, or they have no symptoms at all. And we have no way of detecting that for the MERS coronavirus yet, because we don't have the right diagnostic test. But as soon as those are developed, then we can go out into the population and say how many people are in fact infected. And it could be that thousands and thousands of people have been infected with very little disease, which of course would bring the mortality rate pretty far down.
Right. Health authorities basically have no idea where the original source of MERS is from. Some have suggested bats. Even one report I saw suggested camels. What are your thoughts on that?
So the bat story comes from the fact that when you sequence the genetic information of viruses, you can tell which are related to other viruses. And the closest relative of this virus, and aside from other coronaviruses that infect humans, is a virus that was isolated from a bat back in 2008. So it suggests, but it doesn't prove, that this virus might have originated in bats. Of course, SARS coronavirus originated in bats as well. Right. Bats harbor a lot of diverse coronaviruses, so it wouldn't be unusual that the virus jumped from bats. Now, people in general don't really contact bats very frequently, so the idea is that maybe there's an intermediate animal that this virus went through. In the case of SARS coronavirus, we think the virus went from a bat to a palm civet and then into people. And it could be that, in this case, the MERS coronavirus originated in bats, and it might be going through, say, camels. So there have been some reports of individuals getting sick with this viral infection after being close to a camel. In one case, I think a person was taking care of a sick camel. So maybe camels acquired the virus from bats and they're passing it on to people, maybe other animals as well. But there are a lot of cases where the patients don't have any reported contact with animals of any kind. So you have to wonder if the virus isn't spreading in people already, again, without symptoms. And that's how it might be getting to some individuals as well.
Okay, Vincent, yesterday a paper came out in Lancet from some scientists from the Pasteur Institute, and they say that MERS doesn't have pandemic potential yet. However, back in May, Dr. Margaret Chan, the Directorate General of the WHO, said it is a threat to the entire world. Who's closer?
I think the Pasteur scientists are probably closer because they're working on it, and we know that it's only, we've infected 80-some-odd people. In the scheme of the world, this is really not very much. So this virus can't, as far as we know, it can't spread efficiently among people. So that's why we say it doesn't have pandemic potential. Now, Margaret Chan is speaking as head of WHO, and she has to be very cautious. If this virus somehow changed, it could acquire pandemic potential. So she's simply sending out a message to health organizations globally, we have to keep our eye on this virus and be ready in case it should get more serious.
All right, Vincent, and the next question would be what many Americans are thinking about. What's the chance of this virus entering the United States, and do we have the public health infrastructure to handle that?
Oh, that's a really interesting question, and I think it might have already come into the U.S. with global travel being as easy as it is. It's very easy to imagine that someone has been infected, say, in the Middle East, has no fever, no symptoms, and has flown to the U.S., shedding virus on the plane, and then, of course, shedding virus within the U.S. Now, so far, we don't have any evidence that that's happening, but it could certainly be going on, and we wouldn't be able to detect it, especially if people haven't been sick yet. So I think it's quite likely that the virus is either here already or would soon be brought in to the U.S. And then the question is, what would happen? Well, as we've seen in the Middle East, mainly really sick people that have gotten infected with this virus. So you could imagine that you could find a very sick person here in the U.S. You might get a few cases of infection, and that would really trigger a lot of panic, I think. What could we do about it? Well, fortunately, we don't have any therapeutics. We don't have a vaccine. We don't have any antiviral drugs. The best we could do would be to try and limit people traveling and interacting with one another. But as you probably could guess, that's virtually impossible.
Yep.
If you don't have a drug or an antiviral or a vaccine, it's really hard to spread, to prevent viral spread. So I would guess that this virus came into the U.S. in a form that could transmit effectively among people, it would spread pretty efficiently. But the good news is that hasn't happened yet, even with global travel. So I suspect it's not in the cards.
All right, Vincent, we're running short on time on this segment. So Dr. Racaniello has a fantastic blog, and I'll give you 30 seconds to plug it.
So I write all about viruses on my blog. You can find it at virology.ws. I write every week about what's going on in the news, try to explain virology to everyone. I also do a podcast weekly about viruses. It's called This Week in Virology. And you can find links to that show at my blog as well. And I also teach a virology course at Columbia University, and I record my lectures, and they're all online for everyone to check out. You can find them at iTunes or at Coursera.org. And you can find links to all of this at virology.ws.
Fantastic. Well, thank you, Dr. Vincent Racaniello from Columbia University. Thank you for lending your expertise on the MERS virus.
My pleasure.